This exercise is called abdominal bracing. I have my patients start out laying on their back, such as this, head on a pillow, and most importantly, the knees bent, or over a bolster, pillow, something like that, just so that you're allowing decreased tension in this area, so more ability to contract, and you'll understand why in a few moments. But the next thing I have is my patient. I will ask him to put his fingers on his hip bones on the top side. So he'll do that now. And he's a smart patient, so he only did it on the side nearest you so that I can utilize this side. So the next thing, after you find this area, you find the hip bones, and then you go just inside of it towards a normal, healthy muscle tissue, and you'll feel the difference between the bone and the tissue. And that's where your fingers are going to rest during this exercise. So then I would cue my patient. I utilize the different cues depending on the patient, and oftentimes I use multiple ones, see which works best for them, so they start to get used to this sensation. So one cue I use is pulling your belly button down towards the table. Another one I use sometimes is I'm going to punch you in the stomach, and oftentimes they'll tense up, because that's what you do oftentimes right before you're going to be punched, or it'll cause them to laugh. And the laughing side of it too, it'll cause the same contraction that I'm going to describe in a moment. The last one is saying, huh. And with the huh, you're exhaling very quickly, really expelling the air out in a quick manner. So all those things can kind of work, and if you need more help with cues, feel free to contact me. But, so now, let's do the huh so people can kind of see it. So do huh for me. Good. And so it's not really too visible, just right there you could kind of see the flicker of the lungs kind of moving for the air. But there shouldn't be much movement. I shouldn't see much movement down at the back. I shouldn't see much up here either. Mainly what you're going to feel is right underneath your fingertips, which is why that is so important. So what will happen when he exhales quickly or utilizes one of the other cues, go ahead, is we'll feel the contraction right underneath the fingertips. And you'll feel it tense up. You'll feel the muscle kind of contract, just like as if you did like a biceps contraction, you can feel, or a biceps curl, you can feel that muscle get firm. It is different than, let me have you just fill your stomach up with air. So that's going to be a different feeling. It's going to be much more hollow, you can relax, feeling. So it's not filling your stomach up, just contracting and pulling this muscle in. And once you kind of get that sensation, then I'll have you do it again. Good. And hold. I have patients in the beginning hold typically for about 10 seconds. And we'll pretend it's been 10 seconds, and then relax, and then I have him repeat that 10 times. So holding 10 seconds, 10 times. And the importance of this, I use this with a lot of individuals, definitely in the beginning, is because the transverse abdominis goes from the rib cage down to the pelvis. That's the muscle that we're utilizing with this exercise. And it wraps all the way around to the back. So literally we call it the natural back brace, your natural corset, anything along those lines. So it really supports and protects your spine from any shearing movements, any movement that is too much that your spine can't handle. So it's very important for doing things like lifting, doing exercises that may bother your back. Typically, if we start stabilizing and activating this muscle, then it'll be beneficial. And this is just the first stage. I typically advance people further on from this, but I always do start here because it is the essential to start everything. If you don't get this, you're going to compensate and cheat at everything else. So, my name is Kirsten Heath. I'm with Vighetti and Associates Sports Physical Therapy, and that was Abdominal Bracing. Thank you.